tibial nerve. It is one of the component of sciatic nerve. Root value: ventral division of anterior primary rami of L4, L5, S1, S2 and S3 spinal nerves. Extent: on the posterior compartment of the thigh, between the junction of upper 2/3 and lower 1/3, the tibial nerve starts. Okay. It ends at the lower margin of popliteus muscle, where it continues as posterior tibial nerve. Branches and distribution. It gives muscular branches to popliteus, plantaris, medial gastrocnemius, lateral gastrocnemius and soleus. It gives articular branch to knee joint. Cutaneous branch. Sural nerve. It is a cutaneous branch which arises from the tibial nerve. Pierces the deep fascia between the two heads of gastrocnemius and ends by supplying the skin over the lateral margin of the dorsum of the foot. Posterior tibial nerve. Posterior tibial nerve. It is a continuation of the tibial nerve. It is the chief nerve of the posterior compartment of the leg. Extent. It starts from the lower margin of the popliteus, descends downwards in the leg and ends deep to flexor retinaculum present near the ankle, between the medial malleolus and medial tubercle of calcaneum. So the nerve ends by dividing into two terminal branches, that is medial plantar nerve and lateral plantar nerve. Relations. The posterior tibial nerve lies medial to the posterior tibial artery in the upper part of the leg. On the middle of the leg, the nerve crosses posteriorly the posterior tibial artery. In the lower part of the leg, the nerve lies lateral to the posterior tibial artery. Branches and distribution. It gives muscular branches to soleus, flexor digitorum longus, flexor hallucis longus and tibialis posterior. Articular branch. It gives articular branch to ankle joint. Terminal branches. It gives two terminal branches, or it ends by dividing into two terminal branches, medial and lateral plantar nerves. It gives cutaneous branch which supplies the heel area on the sole of the foot. That is a calcaneal branch of the posterior tibial nerve, which is a cutaneous branch, ends by supplying the heel of the sole of the foot. Medial and lateral plantar nerves. Okay, these are the main nerves which supplies the structures present in the sole of the foot. There is the muscles of the sole of the foot and the joints and also the skin over the sole of the foot. So the medial plantar nerve supplies the medial half of the sole of the foot and also the medial 3.5 fingers. The lateral plantar nerve supplies lateral part of the sole of the foot and lateral 1.5 digits. Applied anatomy. Injury to tibial nerve or the posterior tibial nerve results in paralysis of the posterior compartment muscles of the leg. So this results in loss of plantar flexion of the foot.